Hello everyone. Today I'll be teaching about the skull, the foramina, and the various structures passing or associated. Now I'll be making a series of short videos where I'll be describing the various foramina one by one so that you understand and learn them. Now in this picture on the left side, this is the interior of the skull. So this is the interior view of the skull, and on the right side, this is the base of the skull. Now you might be wondering why there are two views, because there are some foramina which are very evident and clearly visible in the interior aspect of the skull, whereas some foramina we can only see in the base of the skull. Okay, and how you will also understand that how they are interrelated. In this particular video, I'll be teaching about one foramen, which is known as the jugular foramen. So you can see the jugular foramen is here. Okay, so you can see clearly the jugular foramen in the interior part of the skull, which has been enhanced, and here is the enhanced picture of the jugular foramen. Now let's understand what are the structures passing through the jugular foramen, and there is a small mnemonic by which you can learn and understand the various structures passing. Now the jugular foramen, there is the anterior part. So if you see, this is the anterior part and this is the posterior. Now in the anterior part, the first structure which is associated is known as the inferior petrosal sinus. Now why it is known as inferior petrosal sinus, as I told in my previous video as well, this bone here is known as the petrous part of the temporal bone, right? So inferior means below the petrous part of the temporal bone, there is an inferior petrosal sinus which passes through the jugular foramen. Now if we see the middle part, in the middle part, there are four structures which are passing, and you can learn them as 9, 10, 11 map. So 9th is the glossopharyngeal nerve, 10th is the vagus nerve, and 11th is the accessory nerve. And what is P? P is the map is the meningeal branch of the ascending pharyngeal artery. So map is meningeal branch of the ascending pharyngeal artery. So these are the structures passing through the middle part. Now, next is the posterior part, where you can learn it by the mnemonic JO. Now, J stands for the jugular vein, right? Now, as I told in my video where I taught you about the dural venous sinuses, the junction of the sigmoid sinus with the internal jugular vein, right? So that passes through the jugular foramen, okay? Apart from that, we have the occipital artery, right? So this is the meningeal branch of the occipital artery, and the third one are the emissary veins. So this is all about the jugular foramen. So the next video will learn about the various other foramen, including foramen magnum, foramen rotundum, ovale, and all other structures passing. So in this picture, you can see that I have clubbed all the foramina together with an enhanced picture. On the left side, we have the foramen magnum, and this is the superior orbital fissure. So this one is the superior orbital fissure, right? So the various structures passing, how they are associated, so that you never forget. Thank you for watching my video. Have a nice day. Bye.